Etomidate used to be a favorable go-to drug for rapid sequence induction. When it was first introduced in the US market around the 80s, a lot of hype went about Etomidate having a cardiostable properties. Useful for RSI and cardiac patients, so it seems. Over time, people start to realize that the outcomes of patients who received Etomidate were poor. Numerous research were done and showed that Etomidate can cause adrenal insufficiency and increase mortality in septic patients. But is that all there is to Etomidate? Is it all that bad? Stay with us and let's learn about this fascinating drug and its effects on the body system. This is Mastering Anesthesia, so let's go.
Welcome back everyone. Today we're going to talk about Etomidate. Let's start with the general overview of Etomidate so that you have a general picture of what Etomidate is all about. It has a swift hypnotic effect similar to barbiturate and propofol. It acts at the GABA A receptor complex. It has no analgesic effect. Etomidate has a major advantage over other IV induction agent in terms of that it barely impacts the cardiovascular system. It minimally changes in blood pressure and heart rate. Therefore, it is useful in hemodynamically unstable patients, hemorrhagic shock patients, and also patients with cardiac disease. It also causes light respiratory depression and is also not associated with histamine release. Side effects that we need to be aware of: it increases incidence of PONV, pain on injection, as well as adrenal suppression. An important point that I need to mention here is that it is contraindicated to be used in porphyria patients. In order for us to get to know Etomidate better, it is good that we understand the fundamentals of what makes up Etomidate. Feel free to skip through this part if you want to learn other topics. We're going to keep this part short, straightforward, and simple, so bear with me. Etomidate is an imidazole derivative and an ester. So you have this part here, this pentagon imidazole ring. It is a 5-membered ring with 2 nitrogen atoms located at carbon 1 and carbon 3. This portion of the structure contributes to the anesthetic activity of Etomidate, where it increases the affinity of GABA A receptors towards GABA. And imidazole ring is also responsible for making Etomidate a weak base. This ring, however, also causes adrenal suppression, where it inhibits specifically the 11-beta hydroxylase enzyme. Now let's shift our focus to this side chain here, the ethyl ester, or more specifically ethyl carboxylate, owing to the C double bond O. This portion of Etomidate is responsible for it to be rapidly hydrolyzed by hepatic and plasma esterases, so it has a short duration of action. And lastly, let's direct our attention to this phenyl ethyl group. You have the phenyl ring attached to this ethyl group that is connected to the first nitrogen atom of this imidazole ring. It is responsible for Etomidate's high potency because it confers lipid solubility of Etomidate, and it is also contributes to enantioselectivity of Etomidate, where it has selective action as a hypnotic agent. This carbon at the center acts as a chiral center, causing Etomidate to have 2 different configurations, the R enantiomer and the S enantiomer, making it R Etomidate and S Etomidate. R Etomidate, in a sense, is more potent and less toxic. Another interesting fact about imidazole ring is that this ring becomes water soluble in acidic pH and lipid soluble because it is unionized at physiologic pH, because Etomidate has a pKa of 4.5. And we're done with Etomidate structure. Now let's go to preparation of Etomidate. Etomidate is prepared as a 0.2% solution in 35% propylene glycol. This is a colorless clear solution, and it has a pH range of 4 to 7. This preparation can cause pain on injection as well as IV irritation. For those who do not know, zero point 0.2 is equal to 2 milligrams per ml. As an alternative, etomidate is also prepared as an lipid emulsion with a concentration of 0.2%. This emulsion is prepared at a pH range of 6 to 8, making it more isotonic, and this reduces the incidence of pain on injection when giving etomidate in lipid emulsion. The dose range of etomidate is zero point 0.2 to zero point 0.4 milligram per kilogram. For ease of memorization, we can remember it as 0.3 milligrams per kilo. Onset is within one arm brain circulation of 1 minute. Duration would take around only 6 to 10 minutes. The use of etomidate is very narrow. We use it for induction of general anesthesia. Important points to keep in mind when using etomidate is that it is contraindicated in porphyria. It inhibits adrenal steroidogenesis. It increases post-op nausea vomiting incidence. It can inhibit platelet aggregation and is associated with myoclonic jerks. So let's talk about how etomidate causes all the effects that it does. It induces unconsciousness because it depresses the reticular activating system. The reticular activating system is responsible for the sensation, consciousness, attention, and sleep-wake cycle. Depression of the reticular activating system will naturally result in depression of all dysfunction. Number 2, etomidate mimics the inhibitory effect of GABA. How it does this, etomidate, specifically the R+, etomidate binds to a subunit of GABA A receptor. It increases the affinity of the receptor to GABA neurotransmitter. Reminder that GABA is a major inhibitory neurotransmitter in the central nervous system. Interestingly also, etomidate has a disinhibitory effect on the extrapyramidal motor activity. What this means is that there is a baseline inhibitory effect on the extrapyramidal motor activity, and etomidate cancels this inhibitory effect, causing the patient to have myoclonus or myoclonic jerks. Let's now move on to the pharmacokinetics of etomidate, talking about the absorption, distribution, metabolism, and excretion. As for the absorption, there is only IV preparation that is available, so it is 100% when it's given by IV. The onset is 1 minute, and this is equivalent to 1 arm brain circulation. Distribution-wise, etomidate is highly protein-bound at 75%. It also has high volume of distribution of about 4 liters per kilo. It is rapid in onset because at physiological pH it is highly lipid soluble. This is because etomidate being a weak base and has a pKa of 4.5, so when it shifts to a physiological pH which is more basic compared to its pKa, majority of etomidate will be unionized. So at physiological pH of 7.5, 99% of etomidate will be unionized, therefore will be lipid soluble. Effect of etomidate will last around 6 to 10 minutes. Therefore, the initial awakening is due to redistribution of etomidate from the brain to other highly lipid structures. Next, let's see how etomidate will be broken down. That is in the metabolism portion. It is rapidly metabolized by hydrolysis, by hepatic and plasma esterases, which will convert etomidate into carboxylic acid esters, which is water soluble, and they are inactive metabolites of etomidate. This is very important in exams. As for its clearance, it is around 18 to 25 mL per kilogram per minute. Its elimination half-life is 3 to 5 hours. And finally, excretion. It is highly metabolized, therefore less than 3% is excreted unchanged in urine, and about 10% can be found in bile. And finally, on to pharmacodynamics, how etomidate affects our body systems. Number 1, effect of etomidate on cardiovascular system. Etomidate causes minimal effect on the cardiovascular system. It shows mild reduction in peripheral vascular resistance. Therefore, you can see slight decline in patients' arterial blood pressure. The myocardial contractility as well as cardiac output is usually unchanged. Etomidate causes no release in histamine. Therefore, it can be safely used in bronchial asthma or patients with allergies. Be aware that etomidate causes only light anesthesia. Therefore, during laryngoscopy, laryngeal reflex will still be there and therefore blood pressure and heart rate may still increase. Number 2, etomidate's effect on the respiratory system. It causes minimal respiratory depression. It is also associated with hiccup. Although its respiratory depression is minimal, but it can cause apnea if administered concurrently with opioid. Number 3, effects of etomidate on central nervous system. It causes reduction in cerebral metabolic rate, cerebral blood flow, and intracranial pressure. CPP is well maintained because the cardiovascular system, that is the blood pressure, is less affected. Etomidate also increases the amplitude of somatosensory evoked potential, which shows the etomidate effect causing myoclonus jerks. Apart from that, don't forget that etomidate increases the incidence of post-op nausea, vomiting, and it also does not have analgesic properties. Number 4, particularly important in etomidate, is endocrine function. Etomidate suppresses the adrenocortical function by inhibiting the 11-beta hydroxylase and 17-alpha hydroxylase. Now, this results in the inhibition of the synthesis of cortisol and aldosterone. This particular bit is significant because even a single dose can influence adrenocortical function. Therefore, long-term infusion in ICU is not recommended because it is associated with increase in mortality rate, especially in critically ill septic patients. And there you have it. Thank you so much, ladies and gentlemen, for watching till the end of this video. If you have any questions, any corrections, please do comment down below. Comment, like, subscribe, and see you in my next video.
Thank you for watching. If you find these videos helpful, please hit the like and subscribe button to show your support. Comment down below what topic you want us to cover next. Till next time, see you in the next video.